Thank you, Danny. I'm in Ottawa, as you may know. I'm a professor.
No. F10.
Danny, can you hear me now?
We should hear.
Oh, okay.
I can hear you online.
So can you hear me and see my slides?
Yes.
Great. Okay, so I'm going to get moving here. I've got a lot of slides which I will share with Danny to give to everybody after. They're not secret. There's nothing secret about my slides. First of all, I want to thank Danny and John Robinson and the organizers for inviting me. I really do appreciate this. I wanted to go there in person, but I'm teaching 3 mornings a week and I'm in the middle of grading right now, so it just wasn't possible. Quickly, my disclosures. I do not belong to or donate to any political party. I don't allow lawn signs, federal, provincial, or municipal, on my front lawn because I'm in the media talking about political parties all the time and I don't want to be accused of being partisan. Secondly, I do not consult to anyone or anything anywhere concerning any aspect of healthcare or pharma, directly or indirectly, anywhere in the world. Thirdly, I'm going to be flashing through some slides of graphs because they're very visual, and I only use graphs data from the government of Canada, and I mean by that not the parties. I'm talking Statistics Canada, Health Canada, Canadian Institute of Health Information, and OECD data. I don't use data from MPs or interest groups because I just don't find them completely reliable. I do use data from think tanks though as well. Okay, I just want to show you this because I'm going to be throwing around some buzzwords and phrases and so forth, high income countries, OECD countries. This is just simply a graph from the World Bank showing the world by income. The dark green are the high income countries, what are sometimes called the rich Western countries. And there's only about 35 of them out of 195 countries at the United Nations. About 35 are so-called high income, and of course Canada is one of them, along with the US. This is just showing again a big picture. The world GDP is 80 trillion, and the US, one country out of 195, is 25% of world GDP, and you can see China is another 15%. So two together are 40% of the world. The G20, the 20 largest economies in the world, are about 85% of the world economy. So that's just big picture background before we get into healthcare. Okay, now first, before I get into the bad news that's going to get your heart beating and pumping, I want to give you some good news before I give you the bad news, because there is good news about our country. Although in the last 18 months, there have been all kinds of people saying that Canada's collapsed, we've fallen over the cliff, we're all reduced to eating cat food and dog food. It's just simply not true. There have been some people who have been savaged by the pandemic. There's no doubt about it. But this idea that we've somehow fallen over the cliff and to become a third world country simply is not accurate, statistically, factually. So these are the background slides. This is from Stats Canada, real meaning inflation removed, real GDP per capita. And some people get excited about GDP and say, I don't want to talk about that. Well, GDP is just the totality of all the salaries and all the wages and all the pensions and all the incomes of all the people in one country. So when people say GDP is not important, what they're saying is your wage or your pension is not important. And I don't believe that. I know my salary is very important to me. So we heard for the last 4 years, the middle class had collapsed. And I'm not being partisan. I'm just, whoever said it, I will condemn them or criticize them. Mr. Trudeau did say the middle class had collapsed. The middle class never collapsed in our country. It has not collapsed, and it is not collapsing. And this graph is showing how real GDP per capita, per person, has gone up steadily for almost 100 years. This is Stats Can data. Okay, next one. Because I've heard about how, you know, the safety net has collapsed and all kinds of people are in massive deprivation and poverty. Canada is one of the wealthiest countries on planet Earth. On the planet, out of 195 countries, we are near the very top. This is OECD data. Just to remind everybody, the OECD is a gigantic think tank in Paris, funded by the 35 high-income countries. They're not funded by the private sector. They're not funded by interest groups. They're funded by your taxpayer dollars, by the way. Finance Canada sends multiple millions every year to OECD, as does the US and the UK. And they have some, I think it's 10,000 people there that are statisticians, mathematicians, economists that collect data and work with the national statistical administrations of these countries. So this data is gold. We are one of the wealthiest countries in the world. 5, according to this graph from 2019 data, very fresh data in the world of stats, we're about the 5th in terms of per person. So the myth that we have somehow, there's massive deprivation in our country is not supported by the data. And you've probably heard some NGOs and some politicians say that poverty is skyrocketing in Canada. It simply is not true. Poverty has been steadily declining. In 1965, I was 12 years old. The poverty rate was 25% of Canada was below the poverty line, according to Statistics Canada. We have come down to 15% in the 90s from 25%. We're now down to 8.7%, less than 1 in 10. People may say that's too high, but the idea that it's going up is simply false. It's not going up, it's going down. We've heard frequently about the inequality in Canada. In fact, the leader of the NDP has said it is skyrocketing. When you look at the OECD data, we are below the average of the wealthiest countries in the world, which is the OECD countries, and it's showing this on this graph. But even more importantly, you can say, well, who cares about comparing us to other countries? StatsCan reports this data. And income inequality peaked in 2006 when then Stephen Harper became the Prime Minister. It has been going down since, not up, down. Inequality is not going up, it's going down. And I have actually sent a couple of notes to people that work in the NDP saying, will you please do your homework and get your facts right? Because what you're saying is not accurate. And by the way, you can go look up the speech of the governor of the Bank of Canada, September 2020. And on page, I think it was 5 or 6, he reproduced this graph saying inequality is income inequality between the top and the bottom is declining in Canada. The OECD publishes extensive publications and research on inequality. It's a big issue with the OECD researchers. And this is showing over the last 10 years, Canada is in the top third of the wealthiest countries in the world for reducing inequality, not increasing it, reducing it. We're in the top third with GBR, Great Britain, New Zealand, NZL, NOR is Norway, DNK is Denmark, if you're looking at the graph there, SWE, as you can guess, is Sweden. Imagine, we're in the same country as Denmark and Sweden. I thought that that was illegal, that we could be in the country, in the same category as the famous progressive Scandinavian countries. We have been improving or reducing the inequality. We're improving on inequality and well-being by reducing it. When you look at 2017 and look at the comparative performance on material conditions, standard of living, Canada is almost at the very top. I mean, it's incredible. We're up there with Norway and Sweden, and we're ahead of the States, we're ahead of Austria, we're ahead of, so we're not, I'm not comparing Canada to poor countries. Of course, Canada is doing better than poor countries. That's not even a fair comparison. This is comparing Canada to the other wealthy countries, to Germany, to the US, to Sweden, to France, to UK, and we're right up there at the top. Then we look at 2020, which is the most fresh data you can get. That's last year. And in terms of gains in well-being, Canada is second in the world. I'm not here to celebrate. I'm not here to be raw Canadian. That's not my point. I'm saying we got to get our facts right. And unfortunately, most of our politicians are not evidence-based, and they don't look at real data, evidence-based data. And just before I go forward to the next slide, I just want to mention as a sidebar, because some people say, okay, well, where did that data come from? Stats Canada gets all income data from that pesky little agency, you may have heard of it, called Canada Revenue Agency. Where do they get their data from? Well, on the website of Canada Revenue Agency, it says that 29,500,000, I believe, file taxes, tax returns. to the CRA, and they tell the CRA, imagine that, they tell the CRA what they make. What a wild idea. And then they aggregate the data to keep taxpayer records confidential, and they provide that aggregated data to StatsCan that then crunches the numbers. So if you want to know where the income data comes from StatsCan, it comes from Canada Revenue Agency, and the Canada Revenue Agency gets it from all of us every year, once a year, actually. Amazing. Okay, now we can go into the discouraging news. Some might say it's depressing. So I'm just warning you. That's what we call in the university a trigger warning. Okay, here is healthcare spending as a percentage of GDP. We always compare as a percentage of GDP so that we can compare apples to apples to apples and compare to other countries, for example. Otherwise, you're just comparing different numbers of different sized countries. You know, the US is much bigger. Of course, they spend a lot more. So then we want to know what the percentage is. And you can see that it's gone from 5% back in the early 80s. It's up on this graph in 2017 to 7.5%. It's actually higher now. It's up to, it's approaching 11% of GDP. And as you can see, we are, US is not on this table. So all the OECD countries except the US, because the US is such an outlier, they're up to, I think it's 20% of GDP. But when you take out the US, we are spending more as a percentage of GDP than almost any other country in the world. Switzerland's ahead of us. We're even ahead of France, and we're ahead of Germany as a percentage of GDP. Boy, oh boy, we must have a fantastic healthcare system because we're spending so much money. You know, phone up the doctor and 10 seconds later, you got a doctor's appointment, right? Well, you'll see that's not right. Here's the other, I say depressing news. I've joined this club involuntarily a couple of years ago. Nobody asked me if I was going to join the club. They didn't, I'm in the club, the over 65 club, as I'm sure some of you are here listening. You can see that we are an aging society. All the Western countries are, including not just Western countries. China has a demographic crisis of biblical proportions. But we possess an aging crisis as well. So we've gone from 16% over 65 in the 2016. We're approaching 23%, and demographers are predicting we will in sometime in the between 2030 and 2040, we're going to achieve 1 in 4 over 65, 25%. As one American demographer put it, because he said there's only one country in all North America, one place that's has 25% over 65, and that's Florida. And he said in another 10 years, 15 years or so, all the rest of North America is going to look like Florida, but without the warm weather and the nice beaches. So there's a thought to think about. Here's some more news. And this is from CIHI, the Canadian Institute of Health Information, which was established by then Prime Minister Paul Martin, using data from the provincial ministries of health across our country, as well as StatsCan. This is hard data. This is accurate data. This is dollars by age cohort. So you can see from the age of 1 until 55, 65, we spend modest amounts per person per year. So we're spending about $2,000, $2,500 Canadian per person per year until 65. Then at 65, the number jumps big time. As you can see, from 65 to 74, jumps up to about 7,000. Now, some of you may be saying, well, wait a minute, I have a friend who's never been to a doctor in her life, and she's 80 years old, and that's a statistical outlier. These are average, they just take all the people in that age category across the country and divide up all the dollars spent. I'm not criticizing us older people from consuming healthcare. The point is, it's just to put the data on the table to see what the crisis is that's coming down the pipes facing government and taxpayers. And then you look at the 75 to 85 category, 75 to 84, and it's not quite 15,000 per person per year. Then you go to 85 plus, and that's over $25,000 per person per year. And we're all living longer, so we're healthier. But as we get older, parts of our bodies are wearing out. I turned 65. I promptly had 2 knees done, one at 65 and one at 67. And I'm sure I hit the healthcare system for thousands and thousands of dollars for those knee replacements. So then when you step back and look at, okay, this is just Canada, what's the big picture? What's GDP doing? What's healthcare doing? Program and so forth, spending and so forth. Healthcare is growing more rapidly than any other category, period. Okay, it's growing faster than all program spending, which includes, of course, healthcare. So if you take out healthcare spending and say, well, look, how is non-healthcare spending, education, roads, highways, environment, etc., you can see it's growing the slowest. And healthcare spending is growing faster than GDP, which, as I said, is all the wages and all the salaries and all the incomes of all the people in the country. So that's something to think about. So then we turn and say, okay, what's going on provincially? Because, of course, they are carrying the lion's share of healthcare. And this is showing, this is Oecd Data, StatsCan data, and Finance Canada. And it's gone from about a third of provincial spending in 1998. It's now approaching, it's over 40 across the country blended. And in some provinces, as the next slide is going to show you, some places like Nova Scotia and Newfoundland and Labrador are approaching 50%. And Ontario is right behind at 42%. In another 10 to 15 years, it's going to pass 50%. In other words, one category called healthcare is going to consume more than half of the totality of provincial government spending in Canada. Okay, so it's huge. It is just huge and growing larger. So if you're wondering, okay, where's the breakdown? Like how much are we spending on each? This is healthcare spending per capita, per person. These are averages, 2019 data, but by category, dollars and percentages. So healthcare, hospitals are about 26% of the total spending, top right corner on this graph. I'll just look at a couple of the big ones, the bigger ones, okay? A couple I wanted to single up. Physicians are 15% of the cost of healthcare. Prescription drugs, although you wouldn't know it listening to those advocating Pharmacare, you would think that drugs are consuming 100% of healthcare or something close. It's prescribed drugs are about 13%. And I'm going to talk about that more in a moment. Okay, here is the annual growth rate by category, meaning the big ones are hospitals, drugs, physicians, and then public health, which is, helping people in various ways. So as you can see, the hospitals are in my last, from 75 to 79, because it's broken down by years. You can see that other institutions was a huge jump, but I want to jump forward to the period in which we're in right now. That's on the right-hand side of the graph. You can see that hospitals are constraining their costs, their growth in costs, I should say, down to about 2%. And drugs, even though they say that drugs are skyrocketing out of sight, the data is not showing that drugs in terms of the annual growth rate of healthcare costs is about 2%. So it's not. Whereas you can see that the physicians are at 4% and public health and other institutions are at 5%. So this is just another big picture for each of you. And I'll provide these slides to Danny and to John Robson, and anybody can access them if they wish. They're all publicly sourced slides. I don't alter any of them. I don't tweak them or twist them, I just copy them out of reports from these programs, from these publications of these sources. So, okay, so what's the outcome? Let's switch to the outcome. What's going on? Well, the PBO, the Parliamentary Budget Office, set up by Parliament as a non-partisan agency, has been for the last 4 or 5 years looking at the sustainability of provincial governments. Many people focus on the federal government. I am not as concerned about the federal government. I do not mean by that I'm happy that the federal debt is growing like crazy. I'm not suggesting that whatsoever. What I did say is I'm not worried about the sustainability, because the federal government has a printing press that is incredibly powerful, and it's called the Bank of Canada. Just like the American government has a printing press called the Federal Reserve, and the UK have the Bank of England, and they can literally print money. Without getting into whether that's a good thing or not, I don't want to go there. The provincial governments have a big, big problem. They don't have a printing press. The government of Alberta does not have a printing press. Neither does the government of Ontario. They have to borrow money. If they go into deficit, they have to go to real bond markets and sell real government of Alberta or government of Ontario bonds. And most of the time, that's not a problem. Well, except until it isn't. And last year, the bond markets said to the government of Newfoundland and Labrador, so sorry, we're not buying your bonds anymore because you're just way too high risk for us. And they cut them off. And the PBO and the Bank of Canada started buying their bonds. They were bailed out through the back door in the name of the pandemic, of course. The PBO has been studying the provincial government indebtedness, and they've concluded that about 2/3 of the provinces in our country are unsustainable in the medium term. Unsustainable in the medium term. Newfoundland and Labrador actually arrived in the immediate, not the intermediate, the immediate term. And New Brunswick is right behind them. Newfoundland and Labrador with 500,000 people, which is 1/2 of Ottawa. The city of Ottawa, where I live, is 1 million people. Newfoundland and Labrador is 500,000, and Newfoundland and Labrador owes $45 billion. My city, I know I'm comparing bit apples and oranges here, but the city of Ottawa, and we're very concerned about our indebtedness, we've got all the way up to $3 billion. The city of Ottawa, I'm not talking the government of Canada. We owe $3 billion, and we're 1 million people. Newfoundland has half the number of people of Ottawa, but they got $45 billion of debt. And they're going to be bailed. I've been predicting for years, they're going to be bailed out by the government of Canada. It's only a question of time. New Brunswick's right behind them, 500,000 people and billions and billions of dollars of indebtedness. But there's other provinces. As you can see here, from 2010, which was not that long ago, it was only a decade ago, all the provinces together had a much more modest indebtedness. They was less than 15% of GDP. Now look what's happening. It's just growing and growing and growing. And it's going to, in the out years, I'm talking 2040 and beyond, it's really going to surge. And it's really being driven most importantly, by healthcare costs. You look here at this is Finance Canada from the budget, showing from 2010 to 2020, provincial indebtedness, that's all 10 provinces, went from an aggregate 436 billion to almost 700 billion. So that's not quite a doubling in 10 years. Does anyone think that we can double that again in the next 10 years and double it again 10 years after that? Don't think so. There's a crisis coming. There's a day of reckoning coming. The chickens are coming home to roost. We just don't know when that's going to happen. So how are we doing? Because we're spending gargantuan amounts on healthcare. We're number 2 in the world as a percentage of GDP. So we must have just a fabulous, unbelievably fabulous healthcare. We've got the Lamborghini, Rolls Royce, all rolled into one, right? Right? Well, let's look at the very prestigious Commonwealth Fund. It's a think tank, essentially. It's used by Jeffrey Simpson in his book on healthcare extensively. It's used by policymakers in the OECD. And we are, in terms of performance of healthcare, we're second from the bottom. We're second from the top in terms of spending as a share of GDP, but in terms of results, outcome, performance, they're down at the bottom. That's really amazing. I mean, that just boggles my mind. The US, if you're wondering why they're down there and they're spending even more, it's because of the way they evaluate the system. And as you know, in the States, they don't have public healthcare single payer model like we do. Yes, they have Social Security. Yes, they have Medicare, but it's not universal. And so there's a lot of people that still don't access very much healthcare. We don't have that issue. So you could say US is an outlier, and it is. I would say Canada is much more similar in terms of the structure of our systems to these other countries. So why are we below all of them? Why are we below UK and Germany and New Zealand and Sweden and France? So I'm just going to deconstruct, because this is something that puzzles me enormously. If we're spending so much, okay, setting aside from the fact that we're second from the bottom, well, surely at least then we're going to have some really good metrics, right? We're going to have lots and lots of doctors and lots of MRI machines and lots of hospitals because we're spending so much money. So I went to, this is FI stands for the Fraser Institute. So this is OECD and Fraser Institute data, physicians per 1,000 population to control for differences in size in different countries. This is 2018 data, very fresh data. Fresh data. In the world of stats, 2 years old data is very fresh. Look at this. Third from the bottom. Third from the bottom. Okay, this just amazes me. We're spending gargantuan amounts of money, and you would think that we would be right at the top in terms of physicians per 1,000 of population. Actually, we're at the bottom. We're near the bottom. Okay, well, then we must have an awful lot of really good hospitals across the country. I mean, just tons of hospitals, tons of acute care beds, right? Per 1,000 of population to control for size. Actually, we're second from the bottom. Second from the bottom. So we're spending over 200 billion, if you want the number, I didn't put it in the slides. It's over 200 billion a year on healthcare. And yet, what have we got to show for it? Well, we have fewer acute beds per 1,000 than all the other OECD countries, which is really quite astonishing. So then, well, maybe we got lots of technology. Maybe instead, if we're not putting into hospitals and we're not putting into doctors, maybe we're putting it into really amazing technology, right? Well, MRI units per million population. You would think we must have one in just about every hospital, 10 or 20 in every hospital. Well, we're actually fourth from the bottom. We're below the Czech Republic. We're just above the Czech Republic and Portugal, so we're not putting our money into that. So maybe it's CT scanners. Maybe we just don't like MRI and we like CT because they're a more traditional technology. I don't know. Well, we're way down at the bottom again. We're just beating out barely Czech Republic, Slovenia, which I've been to. It's a country of 3 million people, by the way. Lovely country, postage stamp country. Finland, little tiny country. And look at all the other countries ahead of us. And we're spending more than all of them as a percentage of GDP. It's astonishing. Okay, so then you look at, this is a Commonwealth Fund. CF is Commonwealth Fund, very prestigious. So the percentage of patients able to make same-day appointment when they're sick, dead last is Canada. Wow, that takes some special talent, doesn't it? We're spending gazillions and billions of dollars and we're dead last in this metric, on this measure. So what about waiting to see a specialist? And I have some experience in that because of my knees. By the way, I waited 2.5 years to have my first knee done. I was on the wait list from the time I made the contact with the first doctor, actually it wasn't even a doctor, it was a medical assistant, and started the triage process. It took 2.5 years for me to get my knee replaced. So I know something about, anecdotally, I know about meeting specialists, and then the data is confirming my anecdotal experience. Look at how terrible we are. I mean, there's no way to say it. I'm not going to sugarcoat it. We're terrible. We're awful. And yet so many Canadians think we're so proud of our healthcare system. They think it's so wonderful. It's not. It's just not. My joke is, it's not a very funny joke, is the only people that think that the healthcare system is super fantastic, unbelievable, are people that aren't using it. Because if you're using it regularly like I do, because I have rheumatoid arthritis, you know that's not true. You know you can wait a very, very, very long time. Right now in Ottawa, to see a rheumatologist is a year wait in Ottawa, the capital of Canada, 1 million people, and fifth wealthiest, depending on how you measure it, fifth wealthiest country in the world. It's amazing. Let's keep going. This is the median time in weeks. So these numbers you see on this graph are weeks from referral by a GP to treatment. And again, as you can see, we're not doing well at all in this metric. I know this is a busy graph. I will be providing them to you. You can study them at your leisure at a later time, because I've only got 30 minutes with you today. This is average time from referral from GP to specialist. And again, and these are weeks of waiting. Okay, so then you look at the healthcare performance compared to the spending. In other words, the bang for buck, right? The ROI. Okay, you spend a lot of money, but then maybe you're getting really fantastic results, right? So this is called, this graph, the ROI of healthcare spending. Other than the US, which I've already said is a huge outlier, we're at the very bottom. We're below Switzerland, we're below France, we're below Sweden, we're below UK, we're below Norway, we're below Netherlands, we're below Austria, we're below New Zealand. And yet people say, no, it's not true. But the evidence says it is true that we have a terrible system, and something has gone wrong. But wait, there's more. That's Senator Duffy's great line. Wait, there's more. Okay, because everyone's saying, and I think there's a consensus in Canada, we got to put more money into the healthcare system, billions and billions more. The premiers have said so. But I just want to put this in a larger frame for everybody, because there's all kinds of advocates, especially since pandemic started in March, saying that, oh, we got to do a whole bunch of other things. We got to put billions more into long-term care homes, and we got to put billions more into daycare and pharmacare. And so let's just look at these numbers just to make you really depressed. Okay, there's people advocating guaranteed basic income. I actually have argued on Amanda Lang on BNN that we have already achieved a backdoor, not disclosed to the public, guaranteed annual income, or GBI, because the government, as you know, everyone knows, with the CERB and all the alphabet soup programs, we said, okay, we're gonna give you a flat $500 a week regardless of what you made, which undermined and sabotaged the unemployment insurance system, which said you only get a percentage of your income. And they said you don't have to be looking for a job and you can turn one down. Well, what they did is they turned the CERB and the related programs into a backdoor, I argue, and others may disagree with me, into a guaranteed annual income. Now look at the costs, the basic costs. This is PBO data, Parliamentary Budget Office data, and this is for 6 months. They're estimating it'll run anywhere from 45 billion for 6 months to 96 billion. Double those numbers to get the annualized, 100 to 200 billion if we go down that road permanently. This is on top of the healthcare that we're spending, the 200 billion. So Pharmacare, I've been very critical of this in my interviews, because the Prime Minister for about 3 years, as well as the former health minister from Ontario, would go around saying we're the only country in the OECD that doesn't have Pharmacare. And I get really upset at that, because it's not true. We have 10 Pharmacare programs in Canada, 10 provincial Pharmacare. We love Pharmacare so much, we've got 10 of them. The French only have one. What's wrong with them? The Germans only have one Pharmacare program. We've got 10 of them. And we had our top people at the top of the government of Canada telling the Canadians we didn't have any when we had 10. And they want to spend a lot more. This is the PBO numbers for Pharmacare, okay? And you can see net cost of Pharmacare, depending on, there's assumptions in there, but they said it's going to come in at about 23 billion a year. This is real money. Even in Ottawa, this is real money, by the way. Okay. What's so crazy about that is the CIHI report, which is published every year on Pharmacare, the 10 provincial Pharmacare, show that 43.6% of all prescription drugs by dollars in Canada are already paid for by provincial Pharmacare programs. In other words, the bottom income, low income people already have Pharmacare, and people over 65 in most provinces. And so we have an income tested Pharmacare. So we're already paying, we're approaching 50% of all prescription drugs are paid for by Pharmacare. So what on earth are we doing talking about universal Pharmacare? Well, the answer is, and I've said this frequently, is to give high income people like professors free drugs, and public servants and medical doctors. What on earth are we thinking? What is going through our heads saying we want to give free drugs to doctors who make $1 million or $500,000 a year, or senior public servants, or professors like me? But this is on the table, on top of the healthcare we want to spend. So the Conference Board, long-term care, we all think there's a crisis there. We believe there's a crisis, and I'm not suggesting there isn't a crisis there. This is a Conference Board of Canada here in Ottawa, think tank, and they estimate the annual capital cost of new LTC beds in the billions. You can see the numbers there, 2 billion a year, 3 billion a year, rising to, in 2030, to 5 billion a year. Not so quick. Don't stop here. The PBO very recently, as in several months ago, looked at enhancing to meet the current demands by some parties and some interest groups. And they said if we enhance the support for long-term care, it's going to run almost $14 billion a year. Of course, this is on top of the 20-odd billion for Pharmacare. This is, of course, on top of the 200-odd billion for healthcare, and we haven't even got to daycare. Okay, so now let's look at daycare. By the way, I pulled this stat up because I love stats, and this is the number of children in Canada, 2018, 1.4 million. And I have 2 grandchildren, and they are the center of my universe. I love children. Okay, so there's 1.4 million of them. Okay, under the age of, these are children 5 and under. Okay, so 1.4 million in Canada as of 2018. This is from a think tank, Cardis, and they came up with 2 estimates of a universal daycare, national daycare program. And this is the low cost estimate. The total would be by 2025, 17 billion a year. That's federal, provincial, and copay with parents, with the lion's share paid by the feds. Okay. Now we go to the high cost, because there's different proposals out there for daycare, and the more generous, dare I say it, the more liberal daycare model will come in at a bargain basement 36 billion a year. Remember, this is on top of the 25 billion for the Pharmacare, and this is on top of the LT care, long-term care, home care, and on top of the healthcare. And we haven't even talked about the guaranteed annual income. I did before, but I'm just bringing it back. Okay, so Ottawa, we have a problem, a big problem. We are living beyond our means problem, way beyond our means, and it's going to get much worse if we adopt these various programs. So what? Some people say, well, we have a couple of problems that nobody's talking about except Governor David Dodge. Bless him. He's got the graphs, the data, StatsCan data from 1981 to 2019, and we are not covering what we're consuming. That's another way of saying we're living beyond our means, because we're living on borrowed money, some from foreigners and some domestically borrowed from Canadians with money. And worse, I think, well, equally bad, I must say it's worse, equally bad, we have a problem that the total capital, Jack Mintz, the very distinguished person who I admire enormously, unbelievably, Jack Mintz, University of Calgary, has been writing about this in the Financial Post, about the decline in capital investment. And Philip Cross came to my class, the senior statistician, former senior statistician, came to my class about 3-4 years ago to talk to my students. He said, look, capital investment's really clear. You have an easy way of understanding it. The money spent this year in aggregate in capital investment, he said, is going to drive the growth about 4 years from now, 3-4 years. In other words, capital investment today produces the growth in the economy of tomorrow. And our capital investment is going down. And not only that, more and more people with wealth from Canada are going outside of Canada to invest in other countries. And the World Bank, when they talk about third world countries, developing countries, this is called capital flight. Russia is experiencing capital flight. So I've said that normally you don't apply the phrase capital flight to a wealthy first world country like Canada, but I've characterized this as capital flight. People are saying, you know what? I don't think this is a very good place to invest in anymore, you know, because a whole bunch of reasons that I won't go into. We already, probably everyone knows them. But this is not going to end well for us, because our future growth, the capital for our future growth, is increasingly deciding not to invest here. Or governments are telling them they can't invest here. You know, pipelines are bad, you know, oil and gas is bad, refineries are bad. You know, we heat our homes with them. So this is showing, so some people say, and I've heard some of my friends say, look, there's no real problem. We'll just increase the taxes. That's how we're going to solve and pay for all of these social programs. Well, this is a lovely graph showing that Canada, all levels of government are actually, we are already above the OECD average weighted level for taxation. So I'm not saying we can't increase our taxes, but we have to be at least go in with our eyes wide open, not eyes wide shut, with the recognition that Canada is already more heavily taxed. And then you look at it broken down, you can look at it by VAT tax and so forth, consumption taxes, personal income taxes, and Canada is in the upper level of taxation already. So we're lower on consumption taxes, but we're higher, look at that, we're just below Denmark, Iceland, Sweden, Finland, Belgium, and New Zealand. I wouldn't really brag about that. I kind of think that's sort of the rogue gallery, I would think. But anyways, we're right up there in number 5, I think it is, for the rate of personal income tax revenues. And I won't go into my own tax return because that just gets me way too depressed. Okay, so I'm almost done. I've only got 2 slides left. Don Drummond, in this wonderful report for the CD Howe 6-8 months ago, said we Canada are at a crossroads. Indeed, we are. And this graph, you can look at it, it's lovely, showing 4 scenarios, and he's very pessimistic because he doesn't think we're going to get out of our deep indebtedness, and that we may be forced into another downsizing like we saw in 1995 under Prime Minister Chrétien. So my final slide, I'm going to quote somebody who will probably not be someone who is popular with many people here. To govern is to choose. Well, somebody by the name of Pierre Elliott Trudeau said that back in 1970. I remember it vividly to this day. I've used that line so many times in my classes, it's not funny. And he was using it in a slightly different context. Nonetheless, what I'm trying to suggest is we cannot say yes to every social demand, to every person who jumps up and says there's a crisis here, there's a crisis here, there's a crisis there. We cannot agree to universality for everything. And we need to shift and start thinking about partial, not universal, sometimes called targeted, and decentralized to the provinces rather than centralized in Ottawa, where, notwithstanding our belief that we know everything in Ottawa and we know a lot more than all of you outside of Ottawa, we're going to have to set that aside if we don't want to really run into a fiscal crisis down the road. In other words, we have to move away from universality and national standards and national rules to a more decentralized model that is more targeted.